because they find that they're no longer able to manage their lives. They're no longer able to function well. And they find themselves overwhelmed or too stressed out to the breaking point. They want to come to you, right? So even with or without diagnosis label, the client can tell you they take a serious problem. Sometimes they phone you in the middle of the night and say, you're crying, and say, help, help. Right? You're crying in the middle of the night. A big fight in the hospital didn't happen. So the problem is real problem. Because when the client tell you, right, I don't want to spend money, spend time with you. But Carl Jung said, we do try to reduce the kind of pain, right? We do try to remove the pain. Our job is not to remove the pain. Our job is to give them the strength and tools to transform overcome the pain. We're not able to, our job is not make them happy, remove their pain. No. Our job is to make them stronger than their pain. Stronger than their suffering. The suffering can go away, but not able to rise above it. Okay. Did that answer your question?
Philosophically, not pragmatically.
Well, that time with mankind, it works. And you do work, okay? Yes.
I had two really content questions.
Okay.
I missed the last two of the 8 enduring existential questions. That was one. And I
Well,
wanted
it's on the web, you find it on the
It's
web.
on the web?
Yeah.
Okay.
You must say conference staff.
And the other one, I don't think you covered here, but obviously it's an important part of your overall concept. Pure, P-U-R-E, what does it stand for?
Pure is the structure of human life. P stands for purpose.
Purpose?
U stands for understanding. R stands for responsibility.
Oh, right.
E for enjoyment.
Okay, I remember seeing it now. Now it follows out.
Well, it's very important, right? You end up to ask what do you mean by meaning. Pure, right? That's the answer. And that's the most comprehensive answer. 3 more minutes before I collapse. Before I rush the water. Yes.
For patients with generalized anxiety disorder, that I want to know how can we feel ease and walk?
I compare that.
Patients with generalized anxiety disorder, how can we feel walk?
Okay. So we start off finding what they generalized anxiety, right? So generalized anxiety means they don't have any specific object of fear, right? Generalized. So from the existential perspective, there are several types of generalized anxiety. One is death anxiety, the other kind of loneliness, meaninglessness, or anxious about bad, like some bad luck happen to them. So your people suffer from generalized anxiety, okay? So you have to help them to understand the underlying source of the anxiety. Ask them to demonstrate our give an example, couple example. For example, what you're anxious about, okay? In general, it's still about something, right? Cannot generalize that about vacuum. It cannot be a vacuum, right? You have to generalize your anxious about something. And then from that, once why are you anxious about this? Then gradually we'll have a deeper understanding of the source. Or the second thing we'll do, you get continue to be anxious, then as well, you have to accept the fact that you're an anxious type of person. Right? You have to accept, well, you're an anxious guy, right? Well, that can be your strength. That doesn't have to be a limitation. And then you say, well, what can you do? There's a Morito therapy, my friend Ishu from UBC will give you Morito therapy. Morito therapy is based on the principle that Don't worry too much about your feelings. It's simple immunotherapy. Don't worry about your feelings, your anxiety. You got to do what you got to do, all right? You got to do something that's meaningful. You have to pursue your goal. You have to carry on. You inspire your feelings. Then nobody can help them. And anybody can do something about life. Anybody can choose a goal. Anybody can engage in some activity. Then they can feel good about themselves. They can feel their life has some significance. If you're anxious, you can still have meaningful moments. Right? Meaningful moments don't have to be happy moments. Meaningful moments can be a sense of relief when you're generally anxious. For example, when you're anxious, and one day you walk along the seashore, a cool breeze, brush your hair, and you smell fresh air. You feel liberated, you have a sense of, like the last time we went to Australia and we sit on a rock on the sea. Sometimes when you go to nature, you will feel a sense of relief on your power. But that is a meaningful moment, right? So the medicine can do with whatever problem you have. So you can always remove it. You cannot solve it. You can always transcend it, transform it, and live with it, right? Live with it. Live your pain, live anxiety, or transform it, make it more meaningful, or transcend it, and try to reach out to help other people suffer more. There are many tools that you have to use. It's not a symptom reduction. Oh, I'm really, really a good washer now. Oh, thank you for coming.